Hello, I'm Linda Lowen, Naturopath at the Highbury Natural Health Centre. Chronic fatigue syndrome is one of the most common conditions I see in my practice. Today I want to talk to you about the most common cause of chronic fatigue syndrome and how you can determine if this applies to you by looking at typical signs and symptoms and results of the blood tests that you may already have had. We'll also look at treatment and recovery. The most common cause of chronic fatigue syndrome is Epstein Barr virus. This virus causes glandular fever. If the fatigue comes immediately after glandular fever, it's known as post-viral syndrome or post-viral fatigue. However, I want to talk about the chronic fatigue that comes on years later and in people that don't even know that they had glandular fever. Sometimes glandular fever isn't very severe. It looks like tonsillitis and the patient has a week off school or work and then they seem fine. Typically, many years will follow where they get a sore throat and or swollen glands a few times a year, but it never really develops into a cold or flu. Then the fatigue sets in. It may start with the swollen glands and pass, as they do, but over time, it's every day. Their body feels tired, the muscles are weak, and they begin to ache. There may be a year or more where they don't sleep well, but then the exhaustion sets in and they drop off to sleep immediately. Sleep all night and wake feeling like they didn't sleep at all. Let's look at blood tests. If tested for Epstein Barr virus antibodies, there are two types that will show up. One indicates that you've got the virus now, and the other indicates that you've had it in the past. If you've had it in the past, you still have it. The Epstein Barr virus is one of the herpes family. Once infected, this virus will retreat down to the base of your spine and stay there. Every now and then, it will come up to the surface, and that is when you experience the swollen glands. Eventually, the immune system can't fight it off anymore effectively, and it becomes exhausted and you become exhausted. The next thing to look for in a blood test is a white cell count that is generally low. The lymphocytes will be below resting levels, usually less than 2. The percentage of lymphocytes will be high, so they usually sit between 20 and 30% of the total white cell count, but will usually be around 40 to 45%. So what this is saying is your immune system is trying to make mostly lymphocytes, but just not making very many white cells at all. So this will be a typical picture seen in successive blood tests over a few years. The doctor, of course, will say it looks normal because it doesn't show a raging infection. Another sign is that the ratio of neutrophils and lymphocytes will be less than 2. So how is it treated? In my practice, I use herbs in the form of tablets that are antiviral, immune boosting and supportive of your adrenal glands. This treatment usually runs for 6 weeks. Following on, there will be more support to the adrenal glands for a few months or more. This depends on the patient. I will often prescribe supportive nutrients and herbs for liver function and energy production, and to make sure that you have an anti-inflammatory diet. So what can you expect in terms of recovery? You should start to notice subtle changes in the first week. Energy usually starts to pick up in week 2 to 3. By 6 weeks, you know you're feeling better. After that, the treatment continues for a few more months to consolidate the therapy and to make sure you don't relapse. If you would like to contact me for more information, please go to my webpage, naturalfamilymedicine.com.au, and you'll find all my contact details there. Thank you.